There are quite a number, but let me highlight the commonest causes of blindness. So first of all is refractive errors. Refractive errors is whether you're long-sighted, short-sighted, or as we grow a bit older, the difficulty in reading. So I remember seeing my grandma struggling to read her Bible. So that's what comes after the age of 40, 45, thereabout. So those three are easily corrected with glasses. Another one is cataract. Cataract is when the natural lens, it's a natural lens God puts inside the eye. Naturally, it is clear, like a clean window, but over time, or maybe with injury, or patients with diabetes particularly get it a bit earlier, so it becomes cloudy, and therefore the patients complain of cloudy or misty kind of vision. That usually is a cataract, and that is also operable, and then put in an artificial lens and sight is restored. So those are reversible, but we have two very common irreversible causes of blindness. One very common one in our country is diabetic retinopathy. So diabetes is a condition that affects all blood vessels in the whole body, head to toe, and the eye is not exempt. So the blood vessels inside the eye, they get damaged when there's poor control of blood sugar. So diabetes is actually a great cause of blindness, and we encourage all patients who are diabetics to get checked whether or not they have any symptoms, and we advise and advocate for annual checkup for all diabetics at whatever range, because if caught early, it can be managed and controlled and prevent blindness. Okay. Another form of irreversible blindness is glaucoma. Glaucoma is nerve damage. It's a particular kind of nerve damage, and particularly the nerve of the eye, usually associated with high eye pressures and usually symptomless. So checkup is very important, especially if there's a family history of glaucoma, to catch it early and to prevent further damage, because it's irreversible and very important for patients to keep getting checked and not wait for signs and symptoms. Usually by that time it is quite late. Those are four. One that I can't not mention is ocular allergies, very common in Africans, in blacks, and in our setup because of dust, pollen, and all this. So we see quite a number of clients, especially the younger ones, with allergic reactions, and these ones are managed using medications. Yeah. So based on the type of eye condition that one is suffering from, then an eye specialist is able to advise on how frequently they would want to see you. So for example, a patient with a cataract who has had an operation done, then we may not need to see them every month. Maybe once a year will suffice. A patient with diabetes, very important. If there's no eye damage, we'll advocate for annual checkup. However, if one needs an intervention, depending on the intervention, we will say, let's see you next month, let's see you 3 months. So really, it is a case-by-case assessment, but generally, annual checkup is advisable for all patients. Okay. Yeah.